We also have Mr. Young here, our board chair, and Jenny Jones, one of our board of directors, and she's also the chair of the Human Resources Committee. So I want to talk about a significant project that we have sort of within our field division. And the PowerPoint I've put together is a single one, but it takes bits and pieces from 3 PowerPoints, which over the last few months I, along with my team, have shared with the Board of Managers. We regularly have visits by the county manager and the treasurer, so everyone felt like it was a good time to bring the Board of Legislators into the mix. And also, as you know, Dick Chartran sits on our board. So we've been working for the last 6 months on a strategic plan, and I've only incorporated 3 slides because the plan is not yet finalized. It will be finalized over the next month, and once that occurs, then at a work session I'll be able to bring you up to date on that. This picture, I think, gives you a sense for the size of the complex. And then if you look into the distance, you see a lot of forest and farmland, which reminds us that we are a rural county, and we actually cover, quite a large territory. Every pointer is a little different.
You have a lot of animation on this.
Yeah.
Forward, backwards.
So at the bottom of the slide, what you'll see is it's what we entitled the Roadmap to Health and Wellness, and it's a phrase that we brought forward with our annual report. But really the key highlights here, dynamic and change-oriented, and embracing change is crucial. In order for us to be a viable enterprise moving forward, we have to evolve and change. The rest of the world is changing, and when I get into the specifics of today's PowerPoint, I'm going to bring you back to 1931. So we've had periods of time where we have not embraced change, and I can show you that room. We are an important economic asset to the county. 2018 numbers, we generated, goods through jobs and the purchasing of goods, $114 million to the local economy. We're pretty busy. In fact, I expect our numbers will be more in 2018. We had 142 outpatient visits in 1918. 11,000 people were treated in the emergency room. We delivered 200 babies, and we had 232,000 unique medical visits on campus. So when you talk about local access to local health care, these numbers reflect that is happening. So 2 years ago, we brought forward changes to vision and mission. And so our vision, the communities of Lewis County are the healthiest in New York State and America. And when you're the new guy on the block, so within the last 2 years, I've gotten a few pokes with regards to that vision statement. This sort of incredulous sense that we could be the healthiest county in New York State. Well, somebody has to be, so why not us? And it won't happen overnight. It won't happen in 1 quarter or 1 fiscal year or in 2 years. But if we stay the course, we can get closer to that. Our mission is that we are committed to working cooperatively with interested individuals and organizations in helping the people of Lewis County and surrounding communities in achieving their highest level of health and wellness. That's why our work with the outpatient clinics is crucial. So we have the main campus in Lowville. We're to the south at South Lewis. We have a school-based health center at South Lewis Central School, Copenhagen, Harrisville, and Beaver River. We are actively working with South Lewis to provide an athletic trainer. I've met with Lowville Academy, the athletic director and principal, around the school-based health center, as well as athletic trainer services. So I think as an organization, we need to partner with schools, with law enforcement, with social service agencies, with other entities of government, with the private sector. And in doing that, we actually create activity within the health system, but also we keep dollars local. And you all know the benefits of that. So in our strategic plan, we put forward, and when I say we, the Board of Managers, Strategic Planning Committee, and some feedback from up to 140 different people in the community, an aspirational proposition. An aspirational proposition is basically fast forwarding 5 years, and in 5 years, what we would say we achieved. So we create a visual of where we want to be in 5 years. I won't read it to you yet, that'll be the next presentation. But what I'm really trying to highlight is our strategic plan is focused on 3 to 5 years. We're stretching the envelope a little bit so that we can be a viable concern moving forward, and that we evolve and change as healthcare evolves and change. So part of that change includes modernizing the facility. Our facility was built between 1929 and 1931. In August of 1931, they had their version of a ribbon cutting ceremony, and patients were seen. And it has been the predominant place where people have received health care in Lewis County since 1931. So this represents a timeline of what has occurred here. So the hospital opened in 1931, and you can see there was quite a gap between 1931 and 1973 when the nursing home was built. And then we just kind of go through the years. So in recent times, in 2013, the Harrisville Health Center was formed. In 2011, Beaver River Health Center. So in the 2000s, especially the last decade, that is very appropriate, this push to local community having access to primary health care. However, if you look at the hospital, nothing substantive has happened since the new radiology suite in 2006. And what's really interesting to me, the Adirondack edge is the patio as to the right as you went through the building. And we actually talked about that a few months ago. And we just put new drainage and new pavers. There weren't enough projects that we listed that one in 2000, you know. And I thought for a minute to put 2019, you know, upgrade to the Adirondack edge. But, you know, that would have been probably a little silly. What we're trying to illustrate with this slide, though, is buildings such as hospitals, nursing homes, outpatient clinics require ongoing capital investment. And I would say, generally speaking, we've had periods of great reinvestment, but we have not had consistent and sustained reinvestment. And as a result, our average age of plant right now is 19 years, and best practice is 9. So what that suggests is we have some catching up to do. So the East Wing is our medical surgical unit. So why revitalize? Revitalize is the buzzword in healthcare these days. Instead of renovate, we say revitalize. Our rooms are semi-private. Semi-private rooms are obsolete in healthcare now, and they don't help improve infection control measures. The last major renovation in that part of the hospital was in 1963. What is the standard? The standard is private rooms, private bathrooms, which drive lower infection rates, more privacy, better sleep, better healing. The average length of stay in the hospital right now is about 3.2 days per admission. As a critical access hospital, by regulation, it can be as high as 4. So one might say, well, someone's only in for 3 days. That's right, they're only in for 3 days, so we have to maximize the ability to manage your acute visit. I left an organization that was built in 1970. So in 1970, every room in the hospital was private with a private bathroom. This is in 1970. Right now, in 2019, all of our rooms are semi-privates, and we have communal bathrooms in the hallway. None of our rooms have bathrooms. Revitalizing East Wing would allow for more family visiting space. Private consultation areas is how we talk about time with the doctor privately and other healthcare professionals, both for the patient and the family, who often shares the burden of providing care once the person leaves the hospital. Having a modern healthcare facility allows us to recruit new providers. We've done a reasonably good job on the specialty services. We are really struggling with recruiting primary care. And in fact, we will have more good news in the next couple of weeks on the recruitment of specialty providers. There is a link to customer satisfaction and the presentation of the building. And if the customer is satisfied, you tend to drive patient satisfaction scores. And there are payment models now that pay us based on patient satisfaction. And the current layout is inefficient. Our rooms are not standard, and so for those of you who fly planes or drive trucks for work, the standardization of equipment drives the improvement in safety. Same in healthcare. When all the dials and switches and furniture is in the same place in every room all the time, you improve both quality and safety. So revitalizing or modernizing or renovating East Wing would address all of that. So this is sort of what it looks like today. These pictures mean something to me now because I've walked these spaces. This is just a quick snapshot of what we would do. In order to create private rooms, we basically will have to relocate the OR, which is right here. We have 2 operating rooms, a holding area, supplies, clean area, dirty areas, and in a little bit we'll see how this will transition to the operating suite. That actually becomes the next step that allows us to do the East Wing. Is we after consulting with lots of different people, we would relocate the operating rooms. We currently have the 2 rooms with no procedure room. Currently, if you come in for surgery, your pre-operative period is in the 1931 portion of the building. You're then wheeled down the hallway, and it's probably 50 yards plus or minus. Then you're brought into the holding area within the operating room, and then we have 2 rooms. So where we want to go is create 3 operating rooms in a procedure room, which is another way of saying the endoscopy suite. So for any of you over 50, you probably know what happens in that room. Well, we don't do enough of those in Lewis County, and frankly, we should be doing more. And right now, if you wanted to schedule a colonoscopy, you'd probably be out 2 months, 2.5 months. And in fact, our surgical volume, as measured in minutes, which is how we measure it for reimbursement purposes, has grown substantively over the last 2 years. So this would be new construction. East Wing would be a renovation or revitalization. This would be new. So this would be a direct entrance from the OB, so where the maternity is now. And then we would have a hallway that would connect to the main hallway in the hallway, and access to this part of the building would come from the number 3 road. So the need for additional ORs. These are the major surgeries we're doing: hips, knees, hernias, hysterectomies, appendectomies. We're seeing a great increase in eye procedures, especially over the last 3 months. Fractures, C-sections, minor surgeries would be the colonoscopies, DNCs, carpal tunnel, and cutting out masses. So if you look from 2015 to 2019, and based on volume through July, we're projecting 116,000 minutes of OR time. You can see we've seen steady growth in the OR. Now, in 2015, you'll see the number of procedures were 1,772. And if you look at 2019, you'll see it's 1,748. So you might say, well, we're doing fewer procedures. We're doing fewer minor procedures and significantly more major procedures. So you can see our major surgeries will have grown from 465 to 1244. Minor surgeries will have actually dropped, and the minor surgeries are primarily the colonoscopies. 2 rooms is not enough. In the surgical practice, along with the diagnostics, lab, radiology, is what drives our ability to fund our primary care practices. So that's how it is we're in Harrisville, Beaver River, Copenhagen, South Louis, and Loudville. Primary care practice does not cover its costs. So this is very traditional in healthcare. You have winners, you have losers. From a financial perspective, the winners are the acute-based services around surgery and diagnostics. The losers are primary care. However, if we're really going to drive success and progress for our mission and vision, we have to create access to primary care. So we have the work, we have no place to do the work. So the OR right now dates back to 1980. So the holding area is 1931. The actual rooms are 1980. Okay, so when you compare it to 1931, 1980 doesn't seem so old, but that's 30 years ago. No, 40 years ago. And I'm responsible for the budget. So that's 40 years ago. Okay, that is old in OR time. That just gives you a sense. We had an opportunity with the Board of Managers to visit the preoperative area, the holding area, and go into the OR suite. Because I think it's important for people to walk this so they can see that, you know, there's not an exaggeration here, that we have really outgrown the space for today's modern practice. So the benefits, it would be accessible from the number 3 road. We'd have designated parking closer to the entrance. We'd have 3 state-of-the-art operating suites, 1 minor procedure room. We would actually increase the number of PACU beds, so that's where you go after the surgery. We'd improve our space utilization. We'd eliminate the storage in the hallway. We receive waivers right now with regards to sterile and non-sterile areas. They need to be bigger and they need to be further apart. Direct access to the OB. Right now, if you need an emergency C-section, you're on a stretcher, you're brought down a hall, 50 yards, you go through another room. You know, there are many men at this table. I can tell you the women in our midst can appreciate that in a different way. To be able to go right from the OB to the surgery area just through a double door without going into the public sector would just improve their experience and hence enhance privacy. So what is the financial impact of modernizing? The ability to recruit and retain. So we've had success recruiting the specialty physicians. Now our challenge is to retain. The ability to sustain the highest level of quality and safety. Additional square, I mean, this is interesting, and I'll talk a little bit about this in a couple of minutes. The additional square footage for the hospital drives additional reimbursement. And you've heard sort of this story before when discussions around DSS have come up. We are paid more if we have more square footage. So we'll come back to that. More surgeries equals more revenue to invest in primary care. And depreciation can be included in the cost of care and what we get reimbursed in our Medicare rate. So what modernization and growth are needed if we're going to compete with Carthage, and they're pursuing a new hospital, and Samaritan, and the new hospital in Utica. At the end of last week, the Board of Managers and I had a chance to receive some Haney's education. That's the trade association for healthcare providers in New York. And at that meeting, I was able to talk to the new chief executive officer who represents the Utica project, the hospitals there. She is another Maine person who came to New York, and they are going to have an incredible facility, $300 million worth. They're only 55 miles from here. Samaritan has put a lot of time and resource in investing in their campus over the last decade. And Carthage has had modest improvements to their facility, but they're looking to build a new hospital, near the high school. These are actual pictures from their organizations, and I've already shown you ours. So how do we want to look in the future? This is, in my world, a standard medical surgical room. You'll see most of the fixtures are at the head of the bed behind a wood panel where you have all the assorted plugs and all the tubes go. You'll see the couch, it's actually a sleeper sofa so families can stay. The day of restricted visiting is pretty much a thing of the past. The recliner, the bed, and the sink. In this corner over here is the bathroom. It's modern, there's a lot of natural light that's coming in. But this is not a room that represents brass and glass. This is basic medical surgical space in today's world. So, we are a critical access hospital. The board and the leadership back several years ago understood, based on our size, our location, and our volume, this designation would be financially important to the hospital. I'm not going to read all of that, but it just triggers that as we invest in our building, we will be able to capture somewhere between 70 and 75% of the investment over the life of the bond in an increased daily rate of pay for the admissions to the hospital. So all of that on this slide and that slide speaks to that. So as a critical access hospital, we have the ability to capture some of this investment. I'm projecting it'll be between $20 and $25 million, what we're trying to do. So we pay first, and then over approximately 30 years, 70 to 75% of it would come back to us. So with that, do you have any questions? I can appreciate I've just thrown a lot out at you. I'm not looking for any decisions today, but if you have grave concern, it's probably something I would want you to communicate to me sooner rather than later so I could address your concerns and figure out what's possible. Andrea?
Yeah, you didn't mention the nursing home at all.
Correct.
Is that really separate from our hospital?
For the purposes of this project and for the purposes of how things are paid by federal and state government, it is. Now, this does not dismiss the 10-year capital budget plan that we put into place. So this is a specific project. There are regular capital improvements happening annually at all parts of the organization. We've actually implemented a standards program at the nursing facility, and 2 of the floors, we have done some pretty extensive facelift and it's looking much better. Our goal is to get all 4 floors done, but we're making that work through our traditional capital budget process, which is between $3 and $4 million a year. So that's how that's being paid for.
So is it staffed any better
Yep.
than it was?
So, you know, Mrs. Jones is our board chair, and I have to answer to her on these matters. We have 7 open positions at the nursing home, is what came up last night. So I think we're doing better. We're basically capturing that in overtime, and it's almost 1-to-1 at this point. Now, in long-term care, you know, one could argue there's always a need for additional staff. One of the things the Board of Legislators and Board of Managers supported us on was the addition of unit helpers. So these are non-certified individuals who do non-certified activities with the residents, leaving those who are trained to do the more personal care or clinically oriented work. So yeah, I'm feeling better, but there's still an opportunity to do even better. Yep. Right.
Do you have an investment number on what that would cost?
Right. Right now, the working number is between $20 and $25 million. We did apply for the state's transformation grant, and we didn't make it through the first round, but then our grant request was moved to round 2. And in round 2, there were only 2 facilities in the North Country that received money. One was Messina at $20 million, and the other was a small facility north of us, and I just don't remember the name. They received $1 million. So I had an opportunity to talk with the Department of Health and share with them what I've just shared with you. I've shared with them the annual report. They've seen the draft version of our strategic plan, and they were very positive and encouraging with regards to our direction. Now, on a practical level, does that mean there's a check forthcoming anytime soon? Probably not in the near term, but they are very intrigued. They've asked for the final version of our strategic plan when it's done. And I spent 90 minutes with them. I was only originally scheduled for 30. So it was really a nice opportunity to build a relationship with folks who are very important to our future. So, you know what, I remain cautiously optimistic. We might have some success in getting some of this paid for through some grant resources.
Well, as you look for bonds,
Yeah, so the next step is we're working with BCA on the architectural drawings that will go out to bid. And then that'll give us our hard number. And then at that point, working, running it through the Board of Managers and seeking their approval. And, well, the way it would work is our Finance Committee, our Executive Committee, then the Board, and then from there come down and work through your committee process. And then, go through, and I'm not really clear of all the steps, but essentially request permission from this body for a bond so that we could initiate this project. It's going to take the better part of the fall and into the early part of next year to get the final drawings done and the pricing done. We have to work through a CON process, so a certificate of need. So that's another reason why a relationship with the Department of Health is very important. At about that time, we would then begin a conversation with this body around bonding this project. At that point, I would probably also bring Jeff Hellinger down because he could be more exact with regards to the critical access reimbursement that would work its way into our rate that would help us over 30 years capture, we think it's going to be some number over 70%, but I'm using 70% from a conservative point of view. Okay. So more to come. This is only the trailer. We'll get your appetites wet here on this one. Okay, if there are no other questions, thank you for your time.
Thank you very much.
Thank you, Ryan.
we have a motion to approve last month's minutes.
2019-303, resolution to appropriate funds in the community services accounts for the increase in funds for the Healing Community Study in the amount of $48,794. Docket number 2019-290, resolution to transfer funds in the Office for Aging Department accounts for the registered dietitian. The amount is $20,000.
So that's the new contract that we did with Open Sky Wellness. We're taking the money from where it would have been in personnel and moving it to the contract line item.
Docket number 2019-300, resolution amending compensation plan of the County of Lewis with reference to Public Health Department to abolish the account clerk typist and create senior account clerk.
So some explanation here. The title account clerk typist only has one employee left with that title. We've eliminated it, and that employee is retiring. So we are trying to modernize that title. You could either go to account clerk, which is a grade 13, or senior account clerk, which is a grade 19. We don't have anything that's kind of right in that grade 16 area. So they are requesting senior account clerk.
Docket number 2019-311, resolution authorizing amendments to the Phase 3 project addendum and appendices agreement between the County of Lewis acting by and through the Lewis County Public Health Agency and Central New York Cayer Collaborative Incorporated, governing the distribution of up to $100,000 in district funds for value-based payment readiness and performance activities to be completed between July 1st, 2018 and December 31st, 2020, with 3 payments of $33,333.33 upon satisfactory completion of each identified milestone in the plan. Docket number 2019-276, resolution authorizing MOU between Public Health Agency and Community Action Planning Council for the purpose of Lewis County Public Health implementing the council's child care project to provide site visits to child care programs, examine and verify child care staff certificates of training, review, approve, revise, and sign child care programs health care plan, and notify Jefferson Lewis Child Care Project if health care plan is revoked. The term is October 1st, 2019 through September 30th, 2020 at a rate of $40 per unit of service. Docket number 2019-276, resolution authorizing memorandum of understanding between Public Health Department and Dr. Daniel Root to accept referrals to conduct hepatitis C virus and human immunodeficiency virus diagnostic testing for clients with reactive/positive rapid HCV/HIV antibody test from Lewis County Public Health.
Any questions?
Cassandra will address them.
Docket number 2019-277, resolution approving contract with Hand in Hand Early Childhood Center for the period of September 1st, 2019 through August 31st, 2020 at the daycare market rate established by Hand in Hand Early Childhood Center and pursuant to the DSS fair market rates as established by the state. The cost for eligible recipients is approximately 1% for the county and 99% federally reimbursed. And it has a bunch of rates there. Docket number 2019-302, resolution approving agreement between the Department of Social Services and Victim Assistance Center of Jefferson County to provide crisis intervention, shelter admission, emotional support, advocacy, information, and referrals for women and their dependent children from Lewis County who are in crisis and in need of emergency safe housing. The term is January 1st, 2020 and ending December 31st, 2020. Cost of $112.22 per person per night. The local share is 25% to 100% depending on the eligibility of the client. Federal share is 50% and state share is 25%. Docket number 2019-298, resolution authorizing Lawrence Dahlhoff, chairman of the Lewis County Board of Legislators and Lewis County executive, to enter into an agreement with the designated executive of Jefferson County for purposes of administering WIOA and entering into agreements to organize and implement workforce development in the Jefferson Lewis areas pursuant to WIOA for the term July 1st, 2019 through June 30th, 2020. Docket number 2019-274, resolution to reallocate funds in the WIO accounts. And we do have one motion. Do you want me to read that or?
No, that's not necessary. I have a question on this motion anyway. I don't know if all of you you've all read through this one, this motion. And Andrea and I have talked about it. We're not sure we like the way I'm not sure I like the way it's written. Motion, I don't mind authorizing her, Jennifer Jones, to refill the employment and training specialist position due to retirement, but that's where I want it cut off. That's where
So the backfills is
the backfills from that position should still come forward to us to see how the procession is going to go. It's like and all related back, any and all related back. I mean, you could technically be several positions that we would be approving the backfills of. Could be 3, 4, 5, correct? I
that
mean,
would
a
be
possibility.
highly unlikely.
Highly unlikely, but we wanna know what's going on. So,
Well, the reason we did it that way is because what's likely going to happen in this situation is that someone in the department is going to get promoted up,
Right.
and then you've got a backfill for that person's position.
Correct.
So instead of dragging this out for another
Well,
month, we thought we'd
I
just
do
try to-
believe it used to be where if you had a person retire, quit, or anything else, it used to be that you would abolish that position, and then the position would have to be then brought back in front of the board as a new position. So it was taking even longer than this procedure would. She can bring back you can refill the position, bring back the next position next month, and still have a faster method than what we were doing before.
Since I've been here for 2 years, we haven't done that, but maybe that's something that
That's what
goes
it
back
used to
further,
be.
I don't know.
Right, you weren't here. Some ways you come back. So, I can't agree to make this motion as far as the way it's written here, but I will agree to due to retirement. Will that work? Is that enough for you, Jenny? To backfill the
That
position?
decision is yours to make. I would remind you that you have allowed us to fill backfills with other positions and other retirements this year. So, I guess I need direction.
Well, I don't like
determine
the
when we
wording
ask
of any
which
and
one.
all.
Huh?
I don't like the wording of any and all.
Correct.
Uh,
So I believe the interpretation is meant to be departmental. So, like we did with, up at solid waste, it was the trickle down effect, but instead of bringing a motion forward with every single one, it was all associated backfills with moving the working supervisor up, and there was, I believe, 4 moves essentially promoting everyone up to then hire an external part-time. So it's all interdepartment, not necessarily transferring individuals external to those departments that want to go, but promotional based.
But it could, correct?
That,
would
that's not
never-
the intention behind that.
Right, but
I
it's
don't-
still.
we would
I don't
never
know
let
if it
that happen,
could,
why
Greg,
would we?
because you have to work within the civil service title series.
Right.
So, so I guess my point would be other departments that's been approved by other departments this year even.
So in this particular
right.
case, just to be clear about what we're talking about, we have a woman who is an administrative assistant type position that will likely move into the retiree's spot and we'll have to replace the administrative assistant. So we can do that next month, then, you know, the department will be without a person for a month, or you can do it 2 separate motions, or you can do however you'd like.
The process for us would be to refill who's retiring, then canvass if indeed that person is selected. So it's not, we're not sending out 2 canvases at the same time. So there really is kind of a break. We don't move forward until one position is filled, then we request the canvas list for the next position to follow procedure. I don't send out 2 canvases at once.
So, I mean, if that's taking more time, so it could actually be done next month.
However you
Well,
guys would like.
It'll likely be into December then if we come back at the November meeting, because we're already, this meeting is for the October meeting, so the next would be November, then canvases would go out, so we wouldn't get anybody until end of December.
What do you guys think?
I talked last time about hiring lag and how it has helped in the budget process in some of the bordering counties. My feeling is we actually backfill very quickly compared to some of the places I've been, both in private industry and other government jobs. And it's to our benefit because we get that money to use on other stuff and our budget is pretty constrained. So I just don't see them come back. I know it slows down the process a little bit, but.
I think
What I
there's
initially
times, and
want.
it depends on the title. So I'll give you a good example. I will have a caseworker vacancy, you know, those are the kind of positions that then drive a lot of overtime. So I think there's certain positions that I would, you know, be standing up hollering and saying, I really can't wait. I end up with a lot of overtime because of lack of staff. This one, I can't tell you that.
Yeah.
If you wanna wait, this would be one that I can stand to wait on, but I'll be back here next month asking for that.
Sure.
That's fine.
I guess so if the question is, if it's budgeted and we know we need it, why the exercise to come back?
I guess I'm gonna say the same thing as Andrew is saying right down here, is that I just don't like the way it's written.
I'm sorry?
I don't like the way it's written.
Oh, okay. I
And I'm
don't
gonna
write the
continue to have that
motions.
problem, Jenny, with the way it's written, because it's just not, it's just not this position and one other. It could be another and another, it could be more than one position below. You could
And
promote
sometimes
somebody.
that happens, especially in my department, there
Right,
could be a lot
very,
of domino effects.
very likely can happen in your department.
Would it be more, user-friendly if we had, that some wordage in there that said there's, no net gain of any employees? I mean, my net gain
That-
is gonna be 0,
That's a possibility that would help, yes.
you know, so I don't know if we can amend that. The net gain
Well,
is no new employees.
I can amend any motion if I wanna bring it to the floor, I can amend it
Okay.
on the floor. So, but, you have a problem with that as long as there's no net gain of employees?
Yeah, I just don't care for that.
I don't, yeah, everybody had the same opinion, I think,
It just-
the way it was worded.
It could set a precedent that we could
Yeah.
be, you know, not going down the road.
Yeah, absolutely, years to come.
I would remind you that you have set some precedent and done this in the past.
Right.
Like her example of solid waste is a good example.
Well, solid waste doesn't come under me, so,
Oh,
there
This
you go.
issue involves 2 positions, right?
This
Go
one in
ahead.
particular?
one retirement,
One retirement and then one moving up.
one
So
moving
it's-
up.
So it's,
It's 2 positions.
it's 2 positions, but the motion could limit it to 2 positions.
Write it as that.
Right,
Okay.
this particular one, but that doesn't mean in the future, it could be a
I
different
mean,
scenario.
Jenny has some positions that it might need 4 different people.
People
Correct.
moving around.
Yep.
I mean, just the way things are structured, so.
Yeah, but this one here, you could just say, 2 positions involved.
Right, that's what I'm going to, yeah, I don't have a problem doing that, but we just didn't like the way it was worded.
The way it's worded now is in all, any
In,
back.
yeah, any and all,
I think we said in the past all associated backfills, maybe that's a more
Maybe that, is that a better
appropriate
term?
way to.
And I don't think anyone had a problem. I
Yeah,
had a problem, it's
associated
just the
back.
wording.
Associated.
Oh, well, then just change associated. Well, yeah.
So I will make a motion
Okay.
to
You wanna read it?
authorize. Huh?
Would you like to read how you want the
No
wording?
problem. Authorize Commissioner Jane Jones to refill the employment training specialist due to retirement and backfill the.
Associated with that
The
title.
associated backfill position this creates.
Thank you.
As long as we get associated. There you go.
Do I have somebody who's gonna second it?
Anybody got any other questions?
Greg, I have one more thing. It's just a little handout we created on all our summer youth employment activities that were done through the year. So, you can just have these. It's hot off the press, so we can look at it. You know what I mean? I think what's interesting, the takeaway is, we get funded to do summer youth employment through, TANF funds. We get money through WIOA funds that you heard about tonight. And then we also get money from Pratt Northam Foundation to put people to work. John's familiar with that because his daughter used to come to the SS for his diversion. This year we're really focused on trying to get people into private sector work, some of our youth, and hoping to entice them to return to Lewis County. So we did have a few students at the hospital. We've had them at Black River Naturals and some other places, but this is just a general report, how many youth we put to work this year and what locations. So you can see what we do for that, okay?
Thank you.
Do I have a second?
Sure. I second. No.
Did Jerry got it?
Oh, no.